Thank you all for coming, and thank you. We have Dr. Ann Falsey here to talk about the vaccine boosters. A lot of information that has been coming out about those recently, and I know everybody has questions. Dr. Ann Falsey is infectious disease Department of Medicine professor and co-director of the, and I'm not going to have the complete name, the evaluation unit vaccine
treatment and evaluation unit
at URMC. Yes, thank you. So I will call on you for your questions, and then we can go from there. Okay. Spectrum News.
Hi, my name is Rich, by the way.
Thanks, Rich.
Rich.
You have a
Yeah, why don't we
question?
just start out with, I know there was some talk earlier in the year about a second, or I should say a third shot or booster shot, and then that kind of went away. What's brought the discussion back up for the need for a booster shot at this point?
Well, I think it's a couple of things. I think the introduction of the Delta variant into the US and seeing how highly transmissible it is one of the concerns. And then there are, increasing amounts of data that there are breakthrough infections in fully vaccinated people. It's a little hard to sort out what is the variant effect versus waning immunity, because kind of both are happening at the same time. So those two things have reignited the discussion, both to keep people well and to maybe cut down on further transmission that's fueling the epidemic.
And I'm sure there's been testing going on about giving people a third dose of this. Can you just kind of touch on how people have reacted to that and kind of some of the research that's gone on?
Sure, we've been involved in a couple of different studies. Early on, we did a booster dose with our Pfizer participants who were in the original phase 1 trial of Pfizer. The first thing you want to know before you start recommending booster shots for everybody is it safe and is it well tolerated? Because sometimes too much of a good thing can be bad. And so we did establish with relatively small numbers, but the reactions and side effects don't seem to be really worse than the second shot. And that is in people where a fair amount of time has gone by, 6 to 8 months. So we're not recommending booster shots if you just completed your primary series. We're also, I should say, we're also doing at the university with Dr. Angela Branch, something we call mix and match, because the other thing that's going to be happening is that, if they really start recommending boosters for pretty much everybody, we may start running into some lack of that accessibility to the vaccine you started with. And so we want to know, can you boost with different products?
And at this point, this is just for people like in that first initial group, frontline workers who have gotten the shot in like January, February earlier in the year. That at this point, that's kind of what the booster shot, who it's for, I guess, right now.
Yeah, so we're not operating on hard information, the recommendations yet. We are presuming, and so the word on the street, so to speak, before we get the official recommendations, is that it would be 8 months after your primary series, and that it would roll out in a way similar to the way the vaccines originally rolled out. And that would be people at highest risk, but also the first people vaccinated. So if you were vaccinated in December and January, you're coming up on sort of 8 to 9 months, and it may be the time. We think it's safe to give a booster at this point, and that you may benefit from getting a booster.
Perfect. Thank you. I almost have a question, so someone else can go.
Thank you. Raven?
Hey, So we kind of touched on the, I don't know why I'm not seeing, maybe, can you guys hear me?
Yeah.
Okay, cool. You kind of touched on first responders. So I have two questions. So the first question is obviously first responders got their shots end of January. So they're coming up on this 8-month mark. Where does 6 to 8 months come from? Can they get the shot past 8 months? Where does that time frame come from?
So it comes from the studies where we've looked at tolerability. So, most of the studies where boosting has been done has been into the 5 to 7 to 8 month range. So we know that if you wait that long, it doesn't mean that if you waited longer, it wouldn't work. It should be fine, but we don't want to be recommending vaccines too early because it may be associated with more side effects, but also because you probably don't need it. So they're tracking the breakthrough infections, and then they're also, the studies have been looking at the safety in that time frame.
Perfect. And you touched on mix and match. That was going to be another question. So if I had 2 shots of Pfizer, I could get a booster of J&J, or if I have 1 J&J, do you get 2 extra shots? Do you get 1 extra shot? How would that work?
Well, we're doing those studies right now. So currently, I believe that the FDA is reviewing data from Moderna and Pfizer. And so the recommendations, I suspect, will be limited to the RNA vaccines. Now, that doesn't mean that if you got J&J, you couldn't get a dose of Pfizer or Moderna. Does that mean you need 2 doses? Because that study hasn't been done, but I suspect it will act like a booster and that you probably don't need a complete immunization series. But again, we are doing that right now. And there is a real priority to get that data analyzed. So we have folks that originally got 1 dose of J&J. It has to be at least 3 months ago, but up to 5 to 6 months ago. And they are getting boosted with a single dose of either Moderna or Pfizer. And so we're going to look at just that question, is that enough? Now, Janssen globally is doing a 2-dose regimen study. They're looking at a second dose at 2 months. And that data, as far as I know, of course, I have to check the news right before I do any of these. They're like, what happened recently? As far as I know, that there is no answer to that yet. The data are not available.
One more question. So obviously, I think earlier in the week or weeks ago, we talked about they recommended immunocompromised people definitely getting a 3rd booster shot. How did that switch come from them to now everyone? And it's a recommendation. So I know there's obviously going to be some people who are going to be like, I'm not going back for a 3rd one. Why is it recommended? Does the first set of shots diminish after 6 to 8 months?
So what happened between the initial recommendation for immunocompromised patients and now that we're hearing maybe it's going to be recommended for all, I can't say why that sort of accelerated. I think the initial recommendation was based on the fact those folks, there is clearly data where they do not have a good antibody response. And with the breakthrough infections, people that are hospitalized are generally people that do not have normal immune system. And that I don't want the general public to panic and be storming their local Walgreens for their booster shots. The data is that the vaccines, all of them, are still very good, not perfect, but very good for severe disease. And most of the severe disease in breakthrough infections are people who do not have normal immune systems. So that's why that group went first. Now they are reviewing the data, and I think that both Pfizer and Moderna have really completed some of the booster data studies, and the FDA is looking at that. And so I'm glad they did the studies. I know there was some criticism for, well, what are you doing boosters for? We don't have, everybody vaccinated. But you don't always want to be playing catch up. And so it's important that we do these studies, we get the information, the FDA start to analyze it. And then what happens is Delta comes along and infections start surging, and they start getting data from other parts of the world that maybe immunity does start to wane. And there is data out of Israel that is a little bit concerning. And so I think they're using all that information and trying to make the best decisions they can as soon as they can. But what I would not want to happen is we would suddenly start having shortages of vaccines because there's so many booster doses being given out and there's not enough for the unvaccinated. I know that the unvaccinated at this point, it's slow, it's door to door trying to convince the hesitant and fearful to get it, but those are the people that are at highest risk. And so we really need to make sure that we continue to push and educate that group of people.
Great, thank you.
Thank you, Raven. Jane from Channel 13.
Hi, thank you for taking my questions. So we're hearing like two words that is being used to describe booster shots. I'm hearing like a third shot and a booster shot. So is there a difference when people hear about that?
Yeah, and I think that comes from the fact that the J&J vaccine is a single dose. So, it gets a little confusing there. I don't think that we can be precise in our terminology. So third dose refers to the RNA vaccines where it's recommended that primary series is 2 doses. And so the booster is a third shot. What they're going to recommend for people that got a single dose of J&J may in part depend on the studies we're doing right now, where they could get a messenger RNA booster shot, but it's really their second vaccination. So it's a little arbitrary.
Okay, all right, glad to clear that up. So in terms of, you said you don't want people to rush and get the third shot as soon as they get their first 2 or whatever the circumstance is. So who should be getting it right now? Is it just whenever your 8 months are up? Is it because if you're immunocompromised?
Yes, and so, every day I get many anxious people asking about booster shots, and I very much understand the anxiety. But I think that we can take a deep breath. This is not like January when you were completely unprotected and you're unvaccinated. People are still protected. And I think in order to do it in an orderly fashion, it's going to have to roll out in the ways that it did originally. You can't just say, open it up, everybody can have a booster, because I think it will create a lot of frustration and confusion. And so the states will, depending on what is recommended by the FDA, they've already recommended it for that 2 to 3% of the population who's truly immunocompromised. They are still quite at risk. You could argue, I don't know that a third dose is really going to protect them. They still need to be very careful, socially distance, use masks, because they do not have normal immune system. That group goes first. And then I believe they will roll it out much the way they did in the beginning to cut down on lines and frustration. The biggest difference is that people don't need to have that sense of panic, that they are still protected. They should do sensible things, which is wear their masks in public and keep a little distant. I know it's frustrating. We all kind of just took our masks off, but it's not so hard to do that. And people should be patient. It will come to you when it's appropriate, and you are protected for the most part against severe disease.
Okay, and just to clear up other things I'm hearing, it's not like the effectiveness of the vaccine ends in 8 months. Like, are people going to be getting booster shots every 8 months for the rest of their lives? Like, if you could just explain that a little.
Right. Yeah, I think this virus is not going to go away. I think that, you know, people have two choices. They can get vaccinated or they will eventually be infected. It's going to be with us for some time. So the reason I think that the booster is sort of rolling out now is twofold, is that we're seeing the breakthroughs, but also the pandemic is spiraling out of control again. And so part of the public health decision is to cut down on the mildly ill people who've been vaccinated. So if you've been vaccinated, it's very clear that those illnesses are a lot milder. And so those folks could be walking around kind of spreading it and they don't even know it. And so if you vaccinate them with boosters, you're cutting down on some transmission as well.
Okay, and I think my last question, I'm not sure if you can answer this, but oh, sorry.
Can I just get to Allie first at Channel 8?
Oh,
Because I know
yeah.
she, and then I know Dr. Falsey has a 1 o'clock commitment, but maybe we can come back to your questions. Allie? Yep.
Yep. Well, I don't know for sure. I think the process will be similar. I suspect if they really open it up to large numbers of people, we will have to go back to some large vaccine clinics. Things have scaled back to more local efforts and pharmacies, but depending on the specific recommendations, we may have larger scale vaccine clinics again. As far as the shots and the side effects, from what we've seen, they're pretty well tolerated, and the side effects are similar to the second shot. Well, I think there are vaccine enthusiasts, just as there are the vaccine hesitant. So yes, I think, you know, from the phone calls and emails that I've been getting, a lot of people are very concerned and are very anxious to get a booster dose. I think the vaccine hesitant, you know, the first job is to get them vaccinated in the first place. And so it's just a slower process where we need community partners door to door and address people's fears, basically one-on-one.
Thank you. And I'm not sure if there's time for one more question, or if you have, I know you have your 1 o'clock, so I don't want to, but Jane, did you have something else?
Yeah, I was just curious about how, if you know anything about it, how it might be distributed, if like mass vaccination sites would be needed to get everyone their booster shot in 8, however many months, or would it be like through your pharmacy?
Well, I do think that we'll have to scale it up in some regard. Certainly, you know, the medical centers, it's not that hard for them. They held large vaccine clinics. I think nursing homes would be another place where those are particularly vulnerable people, and that would be distributed. As far as the general public, I don't know. I think we have the advantage now of, you know, we know, but not we, the euphemistic we, the county knows how to do big clinics now. And so they should be relatively efficient. We have to be mindful of having the clinics where people can get to, that they shouldn't be in locations that for people that don't have cars. So, you know, we have to geographically distribute, but I don't have a crystal ball as to exactly what they're planning, but I would envision something like the first vaccine rollout, but in a little bit more controlled fashion.
Thank you.
Thanks, everybody. And thank you, especially Dr. Falsey.
No,
I hear somebody else.
thanks.
Okay, I thought there was maybe another question, but yes, thank you for your time, and I appreciate everybody's patience with technology issues on my end. Bye, thank you.
Bye, thank you.